Hi, this is just a short segment on general measuring techniques. Getting the right measurement is appropriate not only for the right size product, but it will help later on with documentation also. So for any trunk or spine type device, you typically need 4 measurements. The first would be a natural waistline. That landmark is above the hip bone and below the rib cage is the natural waistline. If someone's relatively thinner, that's real easy to find. If someone's a little bit fleshier, just ask the patient to bend to the side. A crease will form there, and that will be their natural waistline. It will seem too high for you, or to you, but that's where it is. So get a natural waistline, fairly snug measurement, and then you want a full hip measurement that's taken typically with you seated, and you see the patient from the side, so you can see the fullest part of their buttocks. That's where the hip measurement is taken. That should correspond to the area of the greater trochanter. So that's the full hip measurement, and make that one real snug as you can, because the products are sized to that compressed tissue. So make that a real snug measurement. So 2 circumferential measurements, and then 2 length measurements anteriorly from the xiphoid process to the symphysis pubis, less 2 inches. Would be an ideal height for example, an LSO. So you find trunk height anterior, and then trunk height posterior is from 2 inches below the inferior angle of the scapula to the distal margin of the sacrum, and that would give you a posterior height measurement. With those measurements, you can go to the core catalog and find the measurement that you need for that product, and then select the correct size for that patient. The tools you'll obviously be using will be a tape measure, and there are 2 types of tape measures. This one has a tab after the point 0. So point 0 is about 3/4 of an inch beyond the end of the tape, and it's always a good idea to depress the button before you pull the tape out, as opposed to potentially scaring the patient. The other instrument you may want is a goniometer, and obviously that would be used to measure a joint angle. If there's a restriction, you can document that. Again, all that documentation will help with reimbursement, will help with payment, and Dr. Short will cover that in a segment later. So those are general guidelines. You should always be sitting. For trunk or spine measurements, the patient should always be standing. For knee or ankle measurements, the patient will also be sitting. The general guidelines for the knee is that if the measurements, well, you want a full knee measurement, and that's taken at mid-patella with a knee flex between 30 and 40 degrees. A thigh measurement is nominally 6 inches above knee center, and a calf measurement is nominally 6 inches below the patella, or at the fullest part of the calf. So those 3 measurements, again, are always included in the documentation, no matter what the product calls for sizing. So those are the rough general guidelines. We will discuss the specific measurements as we fit each individual product. I hope that gives you an overview, and that's it.